Welcome back to my channel. If you are new here, I'm Chris and I'm a medical doctor and a PhD candidate in epidemiology. And I'm also helping the healthcare professionals to relocate to another countries. Today in this video, I'm gonna share you how to approach step by step after your master degree in public health and public health related masters. So today in this world, it's quite competitive to get a job in public health as well. So you have a clear and strategic plans before you are getting your master, or you before finishing your master. So you need to have strong strategic plans to land a job after your master. So it will make you easy to get a job before master. If you have a strong plan and if you upskill your some knowledge and some skill. So because you cannot cover everything in your master, so some your background experience and some real skill and experience you might need before landing a job. If you are very fresh graduates, it will be quite challenging to get a job in another country. So how can you make your strategic plans? So let's learn with me. So the first step is you need to define your career goal. So I'm studying public health, but you can have a wide range of job varieties in different countries. So you need to specify what I want to be after my after my master. So define your career goal, because you know I already mentioned there are many job titles and positions in public health. So if you want to work in public health, research, or health policy, or global health, or health promotions, or epidemiology, etc. So they have a different job titles and they have different category of job descriptions, and they have different requirements and skills. So you need to define what you want to do or what you want to pursue as a career. If you want to become an epidemiologist, you need to have a strong experience or strong knowledge in surveillance, prevention, control, something like that. If you want to work as a policy, your knowledge of the health policies from different backgrounds or different experience, you must collect before job landing. So the first step is you need to define your career goal. If you are preferring to work in NGO or UN agency or WHO or academics or government sectors or private sectors, I want to ask you, you already identified which sectors you want to work? No. If you you are not thinking about you will be trouble in your job landing. So what career I want to do, which sector I want to land, because requirements and skills are totally different. So for example, I want to become a monitoring and evaluations officer at WHO. So what you have to prepare for the monitoring and evaluations officer. If you want to work as a M&E officer, you have a strong background experience in project management and data analysis, and you need to M&E framework or very different M&E approach in different organizations. So you need to know what is M&E, and you need to know background and strong project management experience. And I went to work as a public health advisor in Canada. So in Canada, what positions are more demanding, or which specialties are demanding, you need to know. And I went to join as a humanitarian NGO like MSF as a health coordinator. So you need to know what coordinator role is, what requirements to become as a coordinator in MSF. So before, if you cannot define your career goal, it will be confused. What I have to do? Some other people said that you need to prepare before you are master, but you don't know what you have to prepare. So the step one is define your career goal before you are finishing your master degree. Otherwise, I repeat you again, you will lose after your master degrees. So what is the step two? Your skills should align with the main roles. So they have a different health rules and requirements. For public health officer, you must have strong epidemiological knowledge. You must be competent in a statistical tool like SPSS or STAR, and you have also experience or knowledge in policy. Where this public health officer is demanding, so in like WHO, CDC, Africa CDC, and other ministries. So every country has a CDC. CDC, working in a CDC as a public health officer is a rising trend because of upcoming diseases and because of many infectious diseases. So if you want to work as a public health officer, your epidemiology skill and knowledge, your statistical tool experience and skill, and a little bit of policy knowledge will make you to get more chances to land in different country CDC and other ministry level job. If you want to work as a health data analyst, and you must be competent in statistical tools like R or Python or Advanced Excel. So in UK, Canada, Germany, and some NGO it's demanding for health data analyst. In EU and MSF, Red Cross, Asia and Africa, you can learn a job title of health programs coordinators. For health programs coordinator, you must have a strong experience in project management and M&E and donor reporting. You don't know how to write donor report, and you cannot land as a health program coordinator in MSF as a very new fresh graduate. So you will think about that. Nobody has an experience since they are fresh graduate. So yes, it's true, but it's a painful experience. Most NGO and most employer want the candidate who have a proper experience, especially in public health. So another job titles like research assistant or research fellow, you can land a job in universities and some European countries. And so it's quite sure you must have a strong research method and knowledge, experience, and academic writing and statistics experience and competency. For a health promotion specialist, you have good in communications, behavior change model. So you have a little bit of knowledge of health behavior change model. They have different models, especially in social science. So I already confused the different models in different behavior change. So you can have your roles and responsibility have to change the people behavior For example, alcohol, for smoking people, for drug using people. So you have to use different model in your job role. So you need to competent and you have a strong knowledge in behavior change model. So which country can I land as a health promoting specialist? So you can land a job in Australia, New Zealand, and some NGOs. So these are the example of job titles, your required skills and tools, and which country is demanding for those job positions. So we will go to next step. If you are pursuing your master degree without any public health experience, it will be barriers, or it will be challenge you to learn who has a proper experience. So you have to gain what experience or volunteering during or after your study. If your master program is 2 years, you can have some semester break. You can work as a volunteer. Otherwise, you cannot get any experience and you cannot land as a very fresh graduate in other countries. But if you have a chance to work in your home country, it's possible for a fresh graduate. Some role are welcoming fresh graduates, like medical officer in some NGO, or team leader in some NGO. You can work as a fresh graduate in your home country. But if you want to land a job in some exotic countries or abroad, you don't have no experience, it will be tremendous challenge, tremendously difficult to get a job. So some internship opportunity in WHO, UNFPD, CDC, Gavi, and Save the Children, and you can practice some your university affiliated hospital or public health department. So you have to make some strong network with your professor or with your supervisor to have some internship or some volunteering experience during your master degree. Or if you are pursuing your bachelor degree, this is the same process. In some university and some you can have a job, or you can have a chance to work as a research assistant role in your health science faculties. In some university, they have a research centers, so you can work volunteering as a research assistant, or what any other role. You can work as an internship or as a volunteer role into your university and your university affiliated research centers. So your internship experience or your volunteering experience, like a 6 months or experience on hands-on experience, will strengthen your CV for the global job. So it means that you have a proper experience in some NGO or in some research centers or in some universities. Yeah. So it means that not very short period, 1 or 2 is not good, and it can strengthen your CV. Like the internship, total internship experience is like 6 months. It can really strengthen your CV, and it means that you are ready to learn a job. And you need to build a job-focused CVs and LinkedIn. So your CV must be achievement-based, quantify impact. So if you are a public health professional, your CV must have a full of achievements, like how many projects you are successfully done, or what is the impact you change according to your budget, or according to your positions, according in your areas or something like that. So achievement-based CV can really attract to some employer. So you need to show the skill of project management, data analysis, and your research experience or health system knowledge and background. So in your master or bachelor in public health, you will not have a lecture like project management. So you will think about why project management is important in my job learning. So project management is popular in NGO and some public health. So you must have additional learnings to get project management knowledge and experience in your job learning journeys. So where can I apply the job for these mentioned job titles and in the global hotspot countries? Also in Canada, you can Canada, their common job titles are public health analyst and community health, and in Australia's health promoting officer and data analyst. And for UK, they have they commonly recruit research and project officer. In Germany, the common jobs are research assistant and policy analyst. And in Netherlands, program manager and M&E roles are the managers, and in Switzerland, global health officer and admin roles are common. So after defining your career goal, you can search which country I want to land a job, and you can improve your skills and knowledge according to those job titles. I will provide some strategic job platform for you and WHO, global health jobs and public health jobs, UK, Australia and Canada. You can see in our descriptions below. And so let's make a summary. In your real roadmap, you must clarify your specialty, and you have to target which country I want to land, and you need to build practical experience, and if you have some certificates in project management or statistical tool, it can strengthen your CV. And you can create a tailor CV and good LinkedIn profile, and applying some global job portal. And the first step in your first job learning journeys, you need to have flexibility in early job. I went to work in a big city. I went to work in big organizations. So please don't do it. You limit from your side first. It will make you to long in your job learning journeys, and you will get some depressions after a period of time, 1 or 2 years of your job learnings, and it will make you frustrating, and it will impact on your mental health as well. So network with alumni and ask for help. Intentionally, you need to connect with them and global health mentors, especially your professor, your supervisor from your program. They have a wide background knowledge, and they have a big network. In some professors, they have good connections from the university and some organizations around the world. So they will definitely help you to introduce someone who is really help you in your job learning journey. So in this video, I hope you can get some idea how to land a job before or after your master or bachelor degrees in public health. See you in my next video.